our session today. That'll be available on our Moodle platform for credit, as well as on our website at envision.unm.edu. If you go there and watch it, there won't be any credit, but if you do register on our website, get in touch with me or with Michelle Widener, and we can help you out with registering for that. So if you do want to receive CME or CEU certificates, please let us know that you're out there. You can use the chat box, or you can unmute here in a moment and let us know that you're there. And kind of engage in more of a interesting conversation. Your video and audio muting or doing and undoing will be down on your left-hand side on the bottom of the Zoom window down there. So if you would like to join us on video, we'd love to see you. And I'll be promoting everybody here in just a moment to be able to do that. So give me just a sec. And we would love to hear your voice as well. Of course, while we're presenting, go ahead and mute yourselves if you would. And then when it's time for questions, go ahead and unmute. We'll be monitoring the chat box as well, so in case you have questions kind of during the session. Our disclosure and accreditation statements are on screen. We're required to have those up in order to offer the CMEs. And we do offer case consultations. If you have a patient that you'd like to consult with us on any of our various sessions that we have here at Envision New Mexico, check our calendar on our website. And if your patient is a Molina Healthcare or Blue Cross Blue Shield New Mexico Centennial Care patient, then you can be reimbursed up to $150 per time you consult with us. So it is definitely worth your time to do so, especially to bill for that. And at this point, if you're on audio or if you can unmute yourself, go ahead and let us know that you're out there. And if not, go ahead and chat into the chat box, and I'll send out a quick message here just to make sure that you can see that chat box come up. Anybody on audio? And go ahead and try again if you already just tried. I muted and then unmuted ourselves. All right, without further ado, I will turn it over to Adrienne, our facilitator for today.
Great. Thanks everyone for joining us this afternoon. This afternoon's presentation is funded by the W.K. Kellogg Foundation, and it's part of a collaborative project to improve breastfeeding support and care in New Mexico. And my name is Adrienne McConnell, and I am a quality improvement coach on the program. I just wanted to let you know that shortly after this presentation, we'll be emailing you a satisfaction survey. And if you would, it's just a couple of questions. If you just would take a minute to fill that out and let us know how we did, it helps us a lot to inform our future presentations. And without further ado, I would like to introduce today's speaker, Heidi Fredine. Heidi is an epidemiologist with 14 years of experience conducting rigorous social science research at the University of New Mexico, and she serves as lead researcher at the Center for Development and Disability, and is also the data and evaluation director for the New Mexico Breastfeeding Task Force. Her research interests include breastfeeding, oral health, transforming data into action, healthcare disparities, and access to healthcare for underserved populations. Welcome, Heidi.
Thank you very much. So we'll start the slides. Did I just forward it here?
And let's go here. Pardon me 1 second here.
Okay, very good. Task Force, and today's session is on New Mexico breastfeeding rates. We'll be looking at data sources and surveillance methods. We have a few objectives. The first is to define the terms breastfeeding initiation, duration, and exclusivity. I'll also be summarizing the Healthy People 2020 breastfeeding goals, and we'll identify at least 2 sources of breastfeeding initiation and duration data and exclusivity data. Here are some questions to keep in mind as we go through the presentation. The first is, which surveillance systems are best for reporting breastfeeding data in New Mexico? And why are breastfeeding rates not comparable across data sources? And what are the limitations of each data source? Recommendations. The AAP recommends that breastfeeding is exclusive for the first 6 months of life and continues for at least the first year of life. And next slide. So these are important because the recommendations drive the indicators for breastfeeding across our breastfeeding data sources. So here are just some quick definitions. Breastfeeding initiation means any breastfeeding was started at the hospital, typically even for a short period of time. Duration or continuation is the length of time for any breastfeeding. Sometimes we talk about the duration of exclusively breastfeeding. And exclusivity is infants receiving only breast milk. So that means no water, no juice, no breast milk substitutes. Okay, so here are the breastfeeding data sources that I'm going to be talking about today. About a year ago, the Center for Policy, UNM's Center for Health Policy produced a report, and they found 11 different sources of data on breastfeeding. They identified only of New Mexico breastfeeding data, meaning that their sample size is large enough to report out at the state level. The last two, the breastfeeding or the newborn screening card, comes from the New Mexico Department of Health, and the CDC's Maternity Practices and Infant Nutrition and Care Survey, the MPINC. Those are hospital data and only show breastfeeding initiation, right? So the first 3 are CDC. The CDC also produces the Pregnancy Risk Assessment Monitoring System, which we refer to as PRAMS, and the National Survey of Children's Health is conducted by the Maternal Child Health Bureau. Okay, so as I mentioned on the previous screen, 3 of these refer to population data and 2 of them refer to hospital data. If you notice on the population data, I've given some sample sizes. The PRAMS data set is by far the largest for our state. Roughly 1,600 per year are surveyed, followed by the National Survey for Children's Health, and then the National Immunization Survey. Okay, next we're going to talk about the Healthy People 2020. Most of the Healthy People 2020 objectives are measured by the CDC's National Immunization Survey. So I realize there's a lot of information on this slide. The first column, the objectives, go through each of the objectives that have to do with breastfeeding that are on the Healthy People 2020. The center column there is green, and those show the rates that are the goals for 2020. The next column shows New Mexico, and these are our current rates as of 2015. And the last column shows the U.S. national rates. So our first indicator is any breastfeeding, which is initiation within 2 days of birth. And you can see that New Mexico is doing very well. We have about 86 any breastfeeding at 12 months of life. And you can see that New Mexico is doing very well on these as well. We're not quite at the 2020 objective. At 3 months of life, who are exclusively breastfeeding at 3 months, and 27% who are exclusively breastfeeding at 6 months. Now, I will say that this was quite a jump for New Mexico, looking at the exclusivity rates from the previous NIS report, or the breastfeeding report card is what comes out biannually, where there was about a 9 to 10% jump from the previous survey. So it would be interesting to look to see how these rates continue, if they drop again. I think that those seem a bit high based on the work that I've done here in New Mexico. The last objective is called formula supplementation. This is for the first 2 days of life. And for this objective, we want to see a lower rate. For the other objectives, we're looking to see high rates. So we're looking at an objective of 14% on the 2020 goals. New Mexico is doing better than that at 10%, and the US average is 17%. Again, I think that that's probably not accurate based on what I know here in New Mexico. That 10% seems really low to me, but we'll continue to watch that rate over the next few years. Okay, so now we're going to go into the National Immunization Survey. This is a CDC survey. It's an annual telephone survey. They do include cell phones, although cell phones have fewer participants than landlines. It includes all 50 states. They survey households with children that are aged 19 to 35 months of age. And then they publish a breastfeeding report card every other year based on this data. In the green box to the side there, I have the questions from the NIS. The first one gets at breastfeeding initiation. So was the child ever breastfed? If they answer yes to the first question, they then are asked how old was the child when they completely stopped breastfeeding. And then the third question gets at when formula was first introduced. And then lastly, they ask about other foods that may have been given to the child, such as juice or sugar water, cow's milk, and when that was first given to the child. So when was the child first fed anything other than breast milk or formula? And based on these questions, they come up with a breastfeeding initiation rate, the duration, and exclusivity. So this slide shows national data, and this is from 2012. And what you can see is about 80%, a little higher than 80%, are initiating breastfeeding, and then it continues to drop, and it's about 29% of moms are continuing to breastfeed at a year. And that's true at both the national level, and the next slide I'll show is the state level. So it's the same rate for both. The green line indicates exclusivity. So this is exclusively breastfed. And we see that infants are exclusively breastfed at a rate of 43% at 3 months and 22% at 6 months of age. And again, it defines exclusive breastfeeding on this slide as receiving only breast milk and needed medications. So I tried to produce the same type of slide using New Mexico data from the breastfeeding report card, which was released in August of last year. And you'll see that breastfeeding initiation rates are relatively high at 86%. And then if you look at exclusivity, see that those are a little bit lower. That's the orange line. We have 52% exclusively breastfeeding at 3 months and 27% at 6 months. And the same percentage for any breastfeeding as we saw for the national level at 12 months of age. Okay, next we're going to go into the New Mexico PRAMS. The PRAMS is a mailed survey. It comes in a booklet, mailed out a couple of times, and if there's still no response, those folks get a telephone interview. These people are all randomly selected based on vital records. The surveys are conducted by the New Mexico Department of Health and overseen by the Centers for Disease Control. Approximately 40 states are participating, including New Mexico. New Mexico has been included in the PRAMS data since its inception back in the 80s. And the survey is conducted at 9 weeks of age, or when the infant is 9 weeks. So here's some pros and cons to the New Mexico PRAMS. We have a very large sample size, about 1,600 per year. We can measure breastfeeding initiation and duration rates up to 9 weeks of age. We can also look at breastfeeding services, the barriers, reasons for discontinuing breastfeeding. There's also information about the 10 steps, and this would come from the consumer's perspective about how those 10 steps were followed at the hospital that they gave birth. The cons are that there are no exclusivity. I mean, you can't get any information about whether or not the infant received anything, other than breast milk or just breast milk. It only measures breastfeeding at the 9-week postpartum time. So we don't have a long continuation period there. And the box to the right in green shows the actual questions that are asked on the New Mexico PRAMS. So the first one is, did you ever breastfeed or pump breast milk, even for a short period of time? Are you currently breastfeeding or pumping breast milk for your baby? And then how many weeks or months did you breastfeed if you stopped? So there's less than a week, and then the number of weeks or months are indicated there. But again, it's only through 9 weeks. And you can see that these questions are very different than the questions that are asked on the National Immunization Survey. So they're not comparable. And also the timeline is different. We're going to break down some of the data for you on PRAMS. What's nice about PRAMS is it has a large enough data set where we can disaggregate by race, ethnicity, by geographic region, by age. So I'll show you some of those slides. This is from 2012, and this is breastfeeding continuation at 9 weeks of age. So we see that non-Hispanic white mothers are breastfeeding or have the highest rate of breastfeeding at 9 weeks, and that's 74%. Native American and Hispanic mothers have about the same rate at 56%. And the average or the total is 61%. This slide shows the age of the mother. And what you notice here is that the older the mom, the higher the rate of breastfeeding. There's not a lot of change, though, between that bar that shows 25 to 34 and then the 35 plus. So those are the green and the yellow bar. Those are fairly close together at 69% and 71%. But we do see that younger moms have a lower rate of breastfeeding.
Heidi, do you have any ideas about why that is, or?
There's a lot of reasons. I mean, a lot of it has to do with education. That these women haven't had a chance to be educated as much yet. But I mean, I would open that up to everyone here, but I think that there are probably many reasons for why that exists. Also, we know that breastfeeding and poverty rates are closely tied, and women who have a higher poverty rate are more likely to not breastfeed. So,
okay, thank you.
Okay, this slide shows breastfeeding by public health region. What you'll notice is that Bernalillo County, which is region 3, has the highest breastfeeding rate, and that's that bright green color in the center, 72%. And the lowest rates are found in the southeastern region, which is region 4. We show a rate of 41% for that area. And we'll talk more about this later. I'll show a map of New Mexico and we'll look at county level rates too. Okay, the next survey is the National Survey of Children's Health. So this data is collected every 4 years, but they are moving to collect it annually. It used to be a telephone survey. It's been asked 3 times so far, in 2003, 2007, and then again in 2011/12. And those were all telephone-based surveys. They are now partnering with the U.S. Census Bureau, and they're going to a paper survey that's mailed out to families. And then there's an option to do a web-based survey. So families can either respond using the paper survey, or they can go on the web and complete the survey that way. This is completely new, and I find it really interesting that this is happening. We know that response rates for telephone surveys have been going down, especially with cell phone use. More and more of the surveys are incorporating cell phones, but people with cell phones have a lower response rate than landline users. And also with this population, we're looking at young moms. These are the people who are having babies, and they're even less likely to have a landline. So I think it's interesting that we're moving in this direction. And I think a lot of people view the U.S. Census Bureau as something that's mandated by the government. I'm wondering if they're going to have a higher response rate now that the Census Bureau is involved in conducting this survey. And I hope so, because it's really difficult to collect telephone survey data. So this is used in all 50 states. Like I said, it's conducted by the Maternal Child Health Bureau. They're the ones who oversee it and fund it. And then the U.S. Census Bureau actually does the mailing and the surveying. They do survey children of all ages, and they kind of break them up into 3 groups. All of the breastfeeding questions are on the youngest age group survey, which is the ages 0 to 5. And for the state of New Mexico, they survey about 500 people per survey. So it's been every 4 years. They're currently in a data collection year. And then they say they're going to start collecting the data annually. So this may end up being a nice data set to look at in the future. I have used this in the past. We did a project with UNM's Bureau of Business and Economic Research through the New Mexico Breastfeeding Task Force back in 2014. And we looked at the relationship, or we were looking at the economic impact of breastfeeding in the state. And this was a nice data set to use because there are breastfeeding indicators on there, as well as lots of chronic conditions like asthma, autism. So you can look at the relationship between chronic illness and breastfeeding with this data set. This would be your go-to for that kind of information. There is a long recall, though. Can you imagine if your child is already 4 or 5 and you're asking the mom whether she exclusively breastfed at 6 months? So that could be problematic. They do ask the exact same questions for breastfeeding that are asked on the National Immunization Survey, and so that part is nice. And like I mentioned, it's best for studying the correlation between breastfeeding and chronic illness. Here's some data from this survey. This is national data. What they show is that about 80%, 79% are initiating breastfeeding. And then if you look at exclusive breastfeeding, that's the pie chart to the right, you can see that 16% of babies nationally are exclusively breastfed, according to this survey. And then they show in the darker gray wedge of the pie that 62% are breastfed, but not exclusively at 6 months. Okay, here's a little snippet of the New Mexico data. So they produce a fact sheet for each state, and you can find the report using the web source at the bottom there. And you can see that we're doing pretty well. The only thing that they report as far as breastfeeding goes is initiation, the percent of children 0 to 5 who were ever breastfed. And what we show as a state is that we're at 81% compared to the national average of 79%. So fairly close, but doing a little bit better. All right, next we're going to talk about the newborn screening card. This comes from the New Mexico Department of Health. So the newborn genetic screening is a blood test that's typically done the first time at 24 to 48 hours of age. And it tests for over 40 different genetic metabolic disorders, and that includes feeding data. New Mexico mandates that infants have 2 of these tests. The second one is at 10 to 14 days of age. Parents can refuse to do the test, but nearly all participate. It's highly encouraged by all pediatricians. The pros are that it provides aggregated infant feeding data by New Mexico hospital. And that the cons are that it has a low quality of data because the data varies significantly by hospital. There's no standardized method of data collection or reporting. We've been told by some hospitals that the information on feeding is completed based on admissions or the mom's intent to breastfeed based on her birth plan, and not necessarily how the infant is feeding at the time of the blood test. This is what the newborn screening card looks like. It has very minimal amount of information on it. And the New Mexico Breastfeeding Task Force has an agreement with the State Department of Health. And we receive data that just within those yellow boxes. So we get information on the food source for the last 24 hours. The choices there are breast milk, soy formula, NPO, or nothing by mouth, lactose formula, tube feeding, or other. And we get that information, and then we also get a hospital code so that we can track how the hospitals are doing as far as exclusive breastfeeding at 24 to 48 weeks of age. So it's just another way to look at it. I will say that the intent of this data set was not to look at breastfeeding rates, but it's a nice way of looking at it anyway. All right, so every year we get this data set in the spring. I just received the new data set for last calendar year, 2016, on Monday, but haven't analyzed it yet. So I'm showing you the previous year's data here. This is from 2015. And based on breastfeeding exclusivity at 24 to 48 hours of age, we've ranked the top 10 hospitals in the state. And the number one, meaning that they had the best exclusivity rate for breastfeeding, was Zuni. I've also starred the baby-friendly designated hospitals. New Mexico has 8 baby-friendly designated hospitals, but if you notice, I think there are 5 of them on here, so they're not even all in the top 10. All of the IHS hospitals are baby-friendly. There are 4 of them in the state. And then we have Presbyterian, Gila Regional, and UNMH. They're at the bottom with 77%. I should also mention that this does not include NICU babies. NICU infants, their feeding rates are calculated separately and reported out separately. All right, now we're going to look at the MPINC. This is another hospital-based survey. It comes from the CDC. Its name is the Maternal Practices and Infant Nutrition Care Survey. Okay, so this survey assesses infant feeding care and maternity care settings. What it really does is look to see whether hospitals are following the 10 steps towards the baby-friendly hospital initiative. All hospitals participate, or at least all hospitals, I should say, are invited to participate. Only those, of course, with maternity care facilities. In 2015, we had a rate of 84% of hospitals in New Mexico who participated. The pros are that it provides data on breastfeeding services and care by hospital, and it allows for comparison between states. The cons are that it's only the state aggregated data is available. Each of the hospitals receive their own report that indicates how they are doing on all of the indicators. But what's available to the general public is just aggregated data for the whole state. Another con is that the quality of the data varies significantly by hospital. It really depends on who's filling out the data, who's filling out the survey, how much information they really know about the topics, whether they're tracking all of these indicators along the way. That's really helpful. This is a national release of the data here. And we're looking at the 10 steps to baby friendly. The first step is model breastfeeding policy. And you can see that the rates are pretty low for the number or percentage of hospitals who have a breastfeeding policy in place. But that number is growing. And in New Mexico, we're actually doing really well. We have 8 hospitals that are baby friendly out of 28 hospitals with maternity care facilities. And that represents about 1/3 of babies that are born in this state. And largely that is due to the fact that UNMH and Presbyterian Hospital here in Albuquerque are both baby friendly. And then down in Las Cruces, Mountain View as well. So you can see in the areas that we're not doing as well are limiting non-milk or non-breast milk feeds. That's number 6. Number 7 is rooming in. Number 9, limit use of pacifiers. And number 10, post-discharge support. And here's a little bit of the MPINC report for the state of New Mexico. We are scored on many different indicators. The highest score possible is 100. We've scored an 81, which is pretty good. We've ranked 20th out of 53, so that puts us in the top 40% or so. Most of what I've cut out, I cut the top part of the report because the entire thing wouldn't fit or it wouldn't be legible if I put the entire thing in here. But you can see that we're doing pretty well, especially on the indicators that I've posted here. Probably the lowest number there is towards the bottom, is 68% of staff are teaching patients not to limit suckling time. In the middle section under feeding of breastfed infants, there's a 22% for supplemental feedings to breastfeeding infants are rare. Some of the things that I didn't put up here are some of the indicators that we need some more work on are educating staff about breastfeeding and also limiting free formula to hospitals, refusing free formula from the hospital level. Okay, here's our map of New Mexico. I've overlaid the New Mexico baby-friendly hospitals. Those are indicated through 3 colors. The red dot means they are not on the pathway. The yellow diamond means that they are on the pathway to becoming baby-friendly. And then we have 8 green stars of baby-friendly designated hospitals. The colored areas for the counties are the breastfeeding rate at 9 weeks postpartum. So this is the percentage of moms who are continuing to breastfeed at 9 weeks of age. So the darker green are your highest rates, and then the yellow is in the middle, kind of like a red light, and then the red counties show the lowest rates. So this is not breastfeeding initiation. This is breastfeeding duration at 9 weeks of age. And you'll notice that there's not an exact correlation between the green counties and where we find the baby-friendly designated hospitals. So currently we have 3 baby-friendly hospitals in McKinley County, 1 up in San Juan County, which is in the northwest corner of the state. Bernalillo County has 2, UNMH and Presbyterian Hospital. Down in Las Cruces, we have Mountain View Hospital, and in Gila Regional is in Grant County, in Silver City, New Mexico. I should mention too that 5 years ago there were 0 baby-friendly hospitals in our state. So we've come a long way. The New Mexico Breastfeeding Task Force has done a great job through their breastfeeding or their baby-friendly hospital initiative project. We've got some strong hospitals in our state, and we have 3 more who are likely to become baby-friendly designated this year. One more here in Albuquerque, that would be Loveless Women's Hospital, Presbyterian Rust in Rio Rancho, and we also have Memorial Hospital in Las Cruces, New Mexico. All right. I will be updating this map. I have new data from PRAMS that goes through 2014, and hopefully I can put those new baby-friendly designated hospitals on the new map as well. So looking ahead, we have a PRAMS toddler survey in our state. This just began this year. We are in a data collection phase. This is a follow-up to the PRAMS survey. So the same moms who completed the PRAMS survey 2 years ago are being resurveyed. And this gives us the opportunity to ask about breastfeeding. And for the toddler survey, we use the same questions that are asked on the National Immunization Survey. So we'll be able to capture breastfeeding exclusivity and longer duration rates. Hopefully that data will be released next year. We also have a 6-week postpartum study that's led by Sophie Peterson here in Albuquerque, and she's working with some of the metropolitan area Presbyterian OBGYN clinics. We are also partnering with UNMH, and they're going to also start to collect this data. So we'll get some more data from moms who are at their final OBGYN visit at 6 weeks and find out whether or not they are breastfeeding, whether they are breastfeeding exclusively, what the supports are, and the reasons for discontinuation at that time.
Sophie Peterson's on the call today.
Oh, good.
Yeah.
Very good. All right. So that's all I have today. Thank you very much. Do you have questions?
If anyone has questions, you can, sorry.
I have one question.
Is it Sophie?
Sorry.
Go ahead.
Sophie, can you guys hear me?
Yes.
Yes.
The top 10 hospitals slide that you showed with that had like the different the baby friendly ones starred and stuff. Which data set was that based on?
That was from the newborn screening data. Yes. So this comes from the blood test that is done at 24 to 48 hours of age. And as I mentioned, it is problematic. We know that, well, for one, not all hospitals participated. Oh, no, that was for a different one, sorry. For this one, what we see is that there's not a standardized way of collecting the data as far as the breastfeeding information goes. So we know that this isn't 100% accurate. It's kind of like garbage in, garbage out, right? This is the best we have. We're hoping that by informing the hospitals of where they stand and where their ranking is, which we're doing on an annual basis, that they'll start to pay more attention to the data that's being reported through the newborn screening card. and that the data quality will improve over time. Did you have something specific to ask about?
It seems to me.
Mm-hmm.
Well, I'm just looking at it, and I mean, the way I'm not super familiar with this, data, but when it's talking about they're being ranked on exclusive breastfeeding, I'm not even sure that that what you showed us on the slide, it doesn't even seem like that card on the newborn screen really even assesses exclusivity, because all it's asking is if the baby got breast milk in the last 24 hours.
It does. Here, I'll show. They can check all that apply. So
Mm-hmm.
I don't know if you can read that on the little yellow box, but I've called it breastfeeding exclusive if they only checked breast, which is number 4. And oftentimes what happens, in the data set is that they've checked both breast and lactose formula. That's probably the most common.
Right.
So I don't know how accurately, this data is collected, but that's the way I'm interpreting it.
Sure. Yeah. I mean, I understand. That makes sense. I feel like I just personally, like, this data set is so faulty. Like, I have a little bit of issue with distributing it to hospitals and allowing hospitals to make, any type of decisions based on this, because there are, I think, several hospitals on your list that are, I can almost guarantee you, not doing as well as they think that they are.
Right. No, I would totally agree.
And I feel
we
like
talked about this. Mm-hmm.
Like,
we'll go back to the list.
I feel like,
top 10. Mm-hmm.
Like, I just feel like this is potentially even reinforcing, it could be reinforcing, not good practices with the hospital.
Mm-hmm. That's a good point. That's something to
Anyway,
think.
those are just my thoughts.
Yeah, we know that we've talked to several people, administrators and lactation consultants at several of these hospitals, and they've indicated to us that their rate is much lower than that. And then in some cases, it could be higher, It just depends on how the data is being collected. But, I mean, in some ways it's nice because it's almost a
Thank you, Heidi. I think this is really helpful.
Sure. Okay.
Sorry.
No, we have data on almost every newborn this way, though, because almost everyone gets the newborn screening test. So it's a way for us to look at kind of across the board. But it would be nice if the data were consistently of high quality, but probably not the case.
Yeah. Cool. Thank you.
Sure.
Please feel free to use the chat box if you don't have speaker capabilities to ask Heidi any questions. And well, while you are thinking about a question, I had another question too about the data collection from the CDC. It was interesting. You made a comment that you felt like those numbers were higher than what you had seen, and I feel like the same thing with the research that we're doing here. And I wonder how they're gathering their data.
So the National Immunization Survey is a telephone survey, and they didn't start including cell phones until 2011. And their landline response rate, let me go all the way back to that, is fairly good. It's about 63, 64%, which is about what we see for prayers too. But for their cell phone users, only about 25% are responding. And we know that more and more people are going to cell phone only households, particularly younger people in this population that we're sampling. So it's really problematic. I mean, I don't know how they're going to deal with it, which is why I thought it was interesting too that this other survey, the National Survey of Children's Health, is going to a web-based paper survey, which is how the census is done as well. Or the census actually is just paper at this point. But I wonder if they will also go to a web-based secure survey system. In general, though, people are over-surveyed. A lot of these surveillance systems overlap. They ask the same information. In some ways, that's good because we can get some reliability out of it. But at the same time, people just feel like they're burdened with too many questions all the time. And, you know, if I get a phone call on my phone and I don't know who's calling, I'm not going to pick it up. And I think that's how most people are, right? So I wonder if they're going to see more success and higher response rates with web-based and paper surveys. And PRAMS also uses paper surveys. Now, for their non-responders, they do follow-up phone calls. And in certain instances in the past, they've even done interviews. So it just depends on the funding. Interviews takes a lot of money. So, but I really don't think that we have 26 or 27% of moms exclusively breastfeeding at 6 months of age.
Alrighty, and we do have a note that came in from Melinda Rogers that she had to step away if she missed something, but can Sophie or Heidi address whether there is data or what the sources are that use of pacifiers affects continuation of breastfeeding?
So what the data asked is, I mean, that's a complicated question because yes, we are collecting data about pacifier use in the hospital, and I know it's controversial whether that affects breastfeeding. I think the consensus generally is that it does, but I am not a clinician. Let's go to that data. That's the MPINC. So here, this is the national MPINC. So number 9 of the baby-friendly 10 steps to successful breastfeeding shows a limit of use of pacifiers. So it shows in the orange line that in 2007 it was about 24%, 25%, and then now we're inching up to 50% in 2013. So we're doing better at limiting the use of pacifiers. And I know it's one of the 10 steps, and it's one of the policies or indicators that we have to follow in order to become baby-friendly. Is there anything else? I don't know if Sophie's still on the line, if she can address that at all, or if Erin's on the line.
Would just add. Yeah, I'm here. I would just say that I think there's been some controversy that's been brought up recently in the literature. I'd say probably maybe in the last year or so, and I believe that at our upcoming hospital summit, we're going to have a speaker address this specific, well, not this specifically, but some of the new supposedly controversial points about the 10 steps. So stay tuned for more information on that at our hospital summit. But that, I think the best evidence really points that early consistent pacifier use shows decreased breastfeeding rates. But if, you know, the 10 steps in detail state that, you know, pacifiers can be used in the hospital for like procedures or other medical indications. For example, babies that are withdrawing. There are some reasons that pacifier use is allowed. But I think that the overall body of evidence shows that early consistent pacifier use decreases breastfeeding rates, but there have been some authors over the past year who have brought up some safety concerns about limiting pacifier use in the hospital. So there is a little bit of controversy about it, but I think I would still hang my hat on, I think, a large body of evidence that shows that early consistent pacifier use decreases breastfeeding rates.
And this is Erin, and I'm just going to chime in. Can you hear me?
Yes.
Okay. So I was just pulling up the protocols from the Academy of Breastfeeding Medicine, and yeah, the limiting of the use of pacifiers in the early days is still on the protocol. from the Academy of Breastfeeding Medicine. And so, you know, that's sort of our gold standard that we go to when there's any question on the evidence. I would have to go and pull up the references, you know, to get any detail on that. But you're also welcome to go to the Academy of Breastfeeding Medicine website and look at the protocols.
And we do have a question from Michelle Martin asking about the slide set that we provided today. And it looks like I just checked our website. It would be on our calendar, but it appears that was not completed yet. I'll get that done as soon as we're done here in about the next 10-15 minutes. So that'll be downloadable from the calendar, envisionnm.unm.edu. Go to our calendar and then today's session. And typically we have those available right before we start, but that'll be done here in just a few minutes.
Are there any other questions?
No? All right, everyone, thank you so much for joining us. And I just wanted
Thank you, Heidi.
Thanks, Sophie.
And I just wanted to remind everyone that we will be sending out a very brief survey after this is finished. And if you wouldn't mind just taking a couple seconds to fill that out, we would greatly appreciate it. So thank you, everyone, and have a great day. And thank you so much, Heidi. That was very informational and insightful. And also have a great weekend coming up. Thank you.
Thank you, Heidi.